we are is we send a pediatrician or a pediatric trained medical professional to your house within 60 minutes to see your kids in their own environment. So what we found is that Manhattan parents especially, there seems to be a gap in care when the regular pediatrician's office is closed and before the next morning and the parent can find another appointment. There are urgent care centers in Manhattan, but they mainly are staffed by adult ER physicians who have very different training than pediatricians. And so for a parent after hours in Manhattan, we're finding that it was very challenging. They either had to wait till the next morning to take their child to the pediatrician, or they had to go to an urgent care that was staffed by an adult ER doctor, or they had to go to the emergency room. And as we all know, going to the emergency room can take up to 4 hours of your time. Your children are exposed to other sick children in the waiting room. And if you have multiple children, it's very challenging to bring all your children with you to the emergency room. So all of our providers are fully vetted, pediatric trained medical professionals. And what we mean by that is they're all pediatricians, pediatric nurse practitioners, or family nurse practitioners with several years of pediatrics experience. We do 4 background checks on all of our providers. In addition to that, we do an in-person interview. So we can guarantee that the person coming to your home is fully vetted, licensed, and board certified in pediatric medicine. But after you place the house call on babydoctor.com, the provider will give you a call to assess the child's symptoms. And based on that call, they'll tell you, is this a situation where Baby Doctor could provide excellent service in your home, or is this really a more emergent situation where you should, in fact, take your child to the emergency room? After that, the provider will then come to your house, and upon arriving at your house, will sort of make an assessment as to whether or not they feel safe. When they get to your house, they'll click on the check-in portal on the app, and that lets us know at headquarters that they're there and they feel safe in their new environment. So we treat everything that is included in the category of pediatric urgent care. So we treat fevers, we treat rashes, we treat common urgent care matters such as nausea, vomiting, allergies, anything that is considered a pediatric urgent care matter. So we're not an emergency service, we don't do pediatric emergency. We also don't do things like suturing or cuts. Those are better served in the emergency room. But what we treat is common pediatric ailments. What I've learned is that it is an incredibly special opportunity to be able to engage with Manhattan patients in their home. My background previous to this had always been in the hospital setting when children were very sick, or in the newborn nursery where children were just coming into this world. And so I had never really had the opportunity to engage with patients on an outpatient setting, much less to be in their homes with them. And I find that it's an incredible way to do a patient-doctor relationship because you really see the patient in their environment and in the environment where they're most comfortable. And for children especially, children do not do well in office settings or in hospital settings because they're scared and they're far more calm and relaxed in their home environment. So I started Baby Doctor with my husband last year in 2015, so we've been around now for 18 months. We launched operations in July of 2016, so several months ago, and we currently cover all of Manhattan.